Grabbing my finding all my buttons here again. Um, just wanted to start off by saying Chimigwech, Egosani to Verna and Mike and Earl and Kim and Darlene for sharing your powerful experiences, and also to Dr. Tate for moderating. Um, yeah, a lot of the stories that you shared, they really hit home for me as well. And maybe before I get started, I'll just introduce myself. My name is Craig Settee. I am a Cree and Anishinaabe man from Winnipeg, Manitoba. My family comes from Fisher River Cree Nation and Dauphin River First Nation in Manitoba. And yeah, I've been asked to moderate today too because of some of my involvement with Dr. Tate's work as a living kidney donor. I'm a living kidney donor to my brother Kevin, and this year I believe is our 13th year since our transplant. So yeah, that's my reason for being involved. So with that, I will move to introduce our next speakers. And I'm pleased to introduce Dr. Sean Spence and Ramona Bighead for the next session. It's called Conversations Between a Donor Physician and a Donor Family, Approaching First Nations Families to Discuss Donation. So Ramona, Bighead's traditional name, translates to many sweat lodge woman. Ramona, I don't want to mispronounce your name in your language, so I'll save it for you to share your traditional name with us. She's a mother of 7, a grandmother of 13, and a great grandmother of 5. This is Ramona's 30th year as an educator. She began her career as a high school English and drama teacher at Kainai High School on the Blood Reserve. She then went on to complete her master's education. She worked at Alberta Education in the curriculum branch, and she has also taught in the Faculty of Education at the University of Lethbridge. She also served in school administration as a vice principal and principal. She is currently the assistant superintendent with Pagan Board of Education Society. Ramona is completing her PhD out of UBC. She's a playwright and director who also loves running, and her favorite NBA player is LBJ, LeBron James. Dr. Spence is an early career intensivist serving as a medical lead at the CRH ICU in Lethbridge, Alberta. He pursued a Master's of Science in Healthcare Quality through Queen's University, which he completed in 2021. In addition to frequent weeks of clinical service, Dr. Spence is passionate about advancing organ and tissue donation in southern Alberta and has worked as a SEND MD since the launch of this program in Alberta. So maybe with that, I'll just ask Ramona and Sean if you wanted to take a moment also to add anything else to the introductions. So maybe I'll leave it to Ramona if you wanted to start.
Okay. Hello, everybody. My name is Agasti Skaki. As you heard, it translates into many sweat lodge women. I come from the Kainai people, which make up part of the Blackfoot Confederacy. We're located in southern Alberta. So I live in Cardston, Alberta, which is just probably a few minutes from the the Alberta-Montana border.
And yeah, thank you, Craig. I'm one of the intensivists in Lethbridge, just finishing up sort of my 7th year in practice. And during that time, have been fortunate enough to learn an enormous amount from patients and families like Ramona. And, I actually hadn't spent much time in Lethbridge before starting work down here. And then moved down here, and you realize that you're very much in Blackfoot territory, and you have a very large population of patients from both Piikani and Kainai. And it's been one of the great pleasures of my career so far to learn about cultural considerations and protocol and traditions. And so I think today Ramon and I are sort of going to talk about things from each of our viewpoints, with maybe some kind of synthesis happening at the end. But Ramona, would you like to go first? I think this is your story to tell.
Sure. So when Manuel first contacted me and we started talking about sharing our stories and our experiences with organ donors, I think for me it was definitely um, being the mother of a daughter who wasn't going to make it, and coming to that realization that she overdosed from fentanyl, and being in the sitting in the ICU in Lethbridge, and you know, part of me is like kind of already knew that my daughter wasn't going to make it, but of course, as mothers, we have hope. And we always pray for miracles. And so that was the state I was in. And this was in May 2022, I believe, or 2021, 2023. And, but prior to that, I had already lost my oldest son in December 2021 to fentanyl overdose, and then a granddaughter that following November 2022 to fentanyl overdose. So this would have been the third family member, child of mine, my grandchild and my second child and a grandchild I was going to lose. So you can imagine sitting in a hospital and coming to that very sad realization that this was going to happen yet again. And so for me, it was, I just want to kind of backtrack first and talk a bit about Shawnee. Shawnee is, she was a triplet. She was born in 1986, and she was an identical triplet girl. She had two sisters, Alani and Oshana. And she was always this really, really, I guess, a real feisty, she was always the triplet who, the other two, she would protect them. She would protect her sisters, and nobody would mess with the girls because Shawnee was there. So, and then she was also, as a kid, she was just a regular kid into baseball and sports and just a good kid. But things happened to her along the way. She got pregnant really young. She was a teenage mom. She ended up in a not a good relationship. She was still a teenager, and she had two babies, and things weren't too good for her. It was an abusive relationship. So then she got out of that one, and then she ended up moving away. She moved to Edmonton. She got into another relationship. I thought it would be better for her this time around, and she had two more children, two daughters. And so when she had passed, she had just been home for the past year. We knew when she was living in Edmonton, she got into the drugs. Uh, I don't know, to be honest. I don't know what happened in Edmonton. That's a part of her life that I'm not really too privy to, because it was so far away, and I wasn't around her all the time. But I know there was drugs, and then her daughters got taken away from her, the two younger ones, and they ended up living with me. And probably about the last year of her life, we went to get her. She was staying at the YWCA in Lethbridge, and I know they try their best to support our people, but the surroundings there are not very good. There's a lot of drugs in that area. Like, you drive there in Lethbridge, you just see it. It's pretty. It's out in the open. Anyway, so we got her home, and she never left her bedroom for about 3 months. I would go in there and I'd try to clean up, and I remember all she wanted to eat was peanut butter and jam sandwiches. And I'd make like pot roast and potatoes, and I'd put it in her room on a tray, and she wouldn't eat it. And I didn't realize that her gums had really deteriorated, and she was losing her teeth. And this is a girl who was gorgeous, like she beautiful girl. All these triplets were. And so I didn't know that. And so after a few months of her just being home, I had her two younger daughters, and and at first her daughters were really reluctant to be around her because she wasn't herself. We didn't really recognize her in terms of her personality. But slowly I felt like Shawnee was coming back, and slowly started getting her some self-esteem. And I called, she wanted to go get her teeth fixed. So I called my dentist in Cardston. I said, my daughter's just, could you guys just be kind to her? She needs her teeth fixed. She's really embarrassed about it. Whatever the cost, I'll pay for it, but could you guys fix her teeth? So she ended up, she never missed her appointments. She was, she'd run from the dentist office is about 4 blocks from my house. She made sure she went to every appointment. I'll never forget the day she came home and she had to get partials, She had new teeth. Her smile was back. And then pretty soon she started, and she always made her own clothes. Like you could bring her some clothes and she'd rip it up here, sew it up here, cut it here. And that was her style. And so she started doing that again. And then at one point she went to help her sister the week before she died. She was helping her sister paint her house, the living room and the kitchen. And then she came home and she said, Mom, I want to go back to school. I'm going to apply at the college, and I'm going to go back to school. And I was like, yeah, and by this point, both of her girls were sleeping with her the last few weeks of her life. Her daughters that, first they were scared of her, angry with her, all those emotions a teenager has against her mother. They were healing. She was sleeping with her girls. They were cuddling. And that really warmed my heart. And so then when this happened, it was a relapse. She wasn't on the streets. She went to Lethbridge, and then she ended up using, and that was it. I got a call about midnight. Someone texted me, Shawnee overdosed and she's on her way to the hospital. She's in emergency. So in my mind, when I heard she was in emergency, I thought, oh, she's going to make it, because why would she be in emergency? I thought she was going to pull through. So about 3 o'clock in the morning, I drove from Cardston to Lethbridge, which is about 45 minutes away, and went in and sat in there. And that's when I kind of had a feeling from what I saw. I knew that things were not looking too good for her. And so eventually we were told that she wasn't going to make it. And that's when Dr. Spence, and I guess that's how we were introduced to each other at that, I just caught the last part of the previous presentation, which was the saddest moment of someone's life turning into the happiest moment of someone else's life. It's a real paradox. And so when Dr. Spence came to me and said that, in one breath, it was like, she's not going to make it. But in the other one, would you consider donating her organs? And he said he was very gentle, very respectful. And he said that he was mandated to ask that question if we would agree to donate her organs. And about a year or so prior to that, one of my relatives, a close cousin of mine, had a lung transplant, and he was still alive. He's still with us today. That was my only connection to organ donor. And so when he had asked me, I immediately just said yes. But I had to also take into consideration she had adult children, she had siblings, she has a father. I had to also, like, for me, I was okay with it, and I was ready to just say, yeah, do it. But I had to make sure that everybody else understood that's what we were going to do. So then when we sat in the room together as a family. Dr. Spence sat with us and explained everything, and then we asked, and I think it was my oldest son, well, second oldest son, Jesse, who was the first one to speak up, and he said, "I think it's a good thing. I support it." Then it was like almost like he just needed one more person to say it. And as soon as Jessie said it, then her oldest daughter, Acacia, said, "Yeah, I support it." Pretty soon, others in the family were all like, "Yeah, yeah, yeah." So then the process, things happened really fast after that. We had some elders come in. Her dad got some elders to come in and pray for us at the hospital. They were so accommodating for us, and they said a prayer, and yeah, and then we took her to Lethbridge or to Calgary, and I followed and sat with her right up until they took her away. So I'll just turn it over to Dr. Spence.
Yeah, I was just going to comment. Storytelling is such a big part of our ways of life as well, and I just want to say thank you for sharing, the story of your daughter as well. Very difficult, and I see the emotion as well you feel, and just wanted to acknowledge that and say miigwech for sharing the story with us. Yeah, Dr. Spence, maybe you could describe a little bit what you've learned from families about what makes organ donation conversations compassionate and respectful, and maybe if there was anything you had as well around honoring families like cultural beliefs and traditions.
Absolutely. Thank you, Craig. So, um, when we were talking about, what we were going to say today, we met last week and kind of reminisced about a number of things. And I think one of the things that ultimately came up is that um, when broaching these conversations with Indigenous patients and families, everything's the same, yet nothing's the same. I think at a very basic level, respect, humanity, and kindness, it can and should and will be part of these conversations that occur with just about anybody, and realizing that oftentimes in the intensive care unit, um, whether you realize it or not, and despite everybody's best efforts, I think you get desensitized to just how grave and sad and upsetting what we do on a daily basis is. But really taking the time and making the space to remind yourself that, while this is my day at work, while this is my job, my profession, this is the absolute worst day of this patient's mother's, father's, sister's, daughter's, son's life. And I think before any interaction, just remembering that somebody's world has now just been irreparably changed, and starting to approach things with the gentleness and kindness that would match such a difficult and catastrophic event. I still remember quite vividly meeting Shawnee, meeting Ramona. I took over her care in the morning from the on-call physician overnight. And, as Ramona astutely said, it was pretty concerning from the get-go, that Shawnee had sustained a really bad brain injury. And we always make a point, and I think it's worth giving credit where credit is due. The program we have in Alberta, what's called the SEND program, is a specialist in end-of-life care, neuroprognostication, and organ donation. And so, while a goal is to help minimize donation miss rates, part of the job is also to make sure that we're being very precise and diligent in rendering a neurologic prognosis in these cases, and making sure that before we indeed tell a family that their loved one has sustained a catastrophic and unsurvivable brain injury, that we have that we've done our due diligence and that we have the information to back it up. But I do remember, expressing my concern, and as time passed, we talked frequently and openly about the new information as it became available. And unfortunately, as we had all feared, we did get to a point where, the clinical exam and the imaging studies and the other pieces of the puzzle did support the fact that there was, an unsurvivable brain injury here. And it was at that point that we, first off talked about, what would Shawnee want us to do in light of this information, and then also offered the potential for organ and tissue donation. But I do, remember having been told by Shawnee's nurse that very sadly, this was not the first time that Ramona had experienced the loss of a loved one from a fentanyl overdose. And so I think that's the part where, while there are certain non-negotiables and things that should be the same for everybody, like, compassion and clear communication and kindness, I think the one thing that's really important to keep in mind is the really unfortunate and stark and striking overrepresentation of Indigenous patients among people who are donating, because we do know that rates of overdose and rates of overdose lethality are unfortunately much higher in Indigenous patients and families. And, you know, sadly too, Ramona's is not the only family where multiple generations or multiple people had passed away. And so just being mindful of the immense and terrible toll that this has had on patients and families, and just acknowledging how difficult and sad and heartbreaking that is. And really just doing what you can to help support, being mindful of what that patient or what that family has gone through, never judging, and just being genuine. And from there, this has led to more conversations with Ramona. This has led to more conversations with members of our Indigenous Wellness Corps. And since this time, I actually feel like I know a lot more now than I did then about, cultural considerations and beliefs. But really, I think the takeaways here can be distilled very simply into number one, um, be kind and be compassionate, and never judge. You have no idea what any of your patients or their families of their loved ones have been through. And so approaching from a place of kindness and respect for them and for the patient is paramount. And then also keeping in mind that there really is no one size fits all. Indigenous families differ greatly in their beliefs. There are some who are very traditional, there are some who are very religious, there are some who are a hybrid. And so, really, just taking the time to build that relationship respectfully and to get to know your patient and their family and what their thoughts and feelings are, and then going from there. But really, I've been very grateful that in just approaching things genuinely and kindly, and taking the time to get to know families and patients. Um, Not only can I say I really can't remember any bad interactions, but I've also felt very, respected and really appreciate the things that people have taught me along the way. And so, it's something that I think I'll continue to learn more over the entirety of my career. But I was very honored to be asked by Ramona to speak about this, and kind of as a testament to this, this is now one of several things that we've worked on together since we met, taking care of Shawnee. And I think, it shows the importance of relationships and respect to all of this. I think that's really what's going to underpin all of this.
Thank you for sharing, Sean. That was yeah, very important to hear those words from a physician perspective, and yeah, glad to hear the work that you're doing is to continue supporting communities and people, dealing with pretty tragic losses and some difficult decisions. So maybe I think we have about just over 10 minutes left. So maybe I'll go to our last question on here too. That's just kind of a conversation between the two of you. So looking back on your experience, what's one thing you wish the other side understood about what was happening in those moments when organ donation was being discussed?
I don't really know. Remember back then I was dealing with I was in a state of shock and trauma, and So it's really hard for me to kind of think back. But I think, like having what 3 years later, and um, I think, I have to say that I there's nothing really that stands out that I would have done it this way or that way. I think it was just like what Dr. Spence talked about, just how he approached and the importance of approaching families, and we all know when we're being judged, we're being when people are being condescending to us, and we don't like it. No one likes that feeling, and especially when it comes to us as Indigenous people, given our the history of what's happened to us throughout the years, right? And I know that there's we've always felt marginalized, even in the health system, the healthcare system. We felt that some people often say things like, "Well, we get treated differently," and the optics are that's what happens, and talk to one another, like what Dr. Spence said, like building those relationships. Then we can start to see why things are the way they are, instead of just looking at it as being racist. But in some cases, I have to say, it is outright racism. There are some cases where you just kind of look at it and you think, yeah, no, that we don't deserve to be treated that way. But no, I can't honestly. Well, no, I would say one thing: explain it more to us, because I didn't understand what that meant. Like, I remember, I'll share this story quick, asking the doctor in Calgary, so does Shawnee's organs, are they going to go to an Indigenous person? And the doctor looked at me like it was, I don't know, organ donor 101. I should have known that. And the doctor said, no, it will go according to whoever needs it, that matches her blood type. And I was like, oh. Then my mind was, well, then why are people so racist if we're all the same on the inside? I remember that was a bit of an aha moment. I had all kinds of questions. And I think the one thing I have to say is this: they had to declare her deceased prior to um, like getting her organs donated. So on her legal, the legal paper says she died on such and such a date, when really it was until maybe a day or two later when they took her away. To me, that's when she died. But legally, it says, like they're trying to say, well, because to me, I really strongly believe her spirit was still with us at that point. Maybe her body was. She was dying, and or she, according to the doctor, she was deceased. But to me, I felt that she didn't die till they took her away. That's my thoughts. I'm not a doctor though.
I think from my standpoint, two maybe quick things that I wish the other side knew. And I think in Ramona and her family's case, it never really became, a difficult or a point of contention because we just had very good and open lines of communication. But I'd love for Indigenous patients and families to know that our goal in discussing organ and tissue donation is never to upset. As had been alluded to in the previous discussion, talking about death and dying is something that is not often done, and is jarring, and then potentially adding in organ and tissue donation to that, which, for some people for whom being buried whole is very important, that can be seen as a potentially upsetting or difficult subject matter topic or goal in bringing that up, even though there are times where people understandably get upset. We don't ever want to upset you, and our goal is to try and do as gentle and respectful of a job as possible in discussing that. And that also, there still are huge inequities and problems with the system. But that, there are many people who acknowledge that and care about that, and bit by bit want to do their part to try and make it less pronounced. And so in having the openness to have these discussions with us and build these relationships, then it's going to allow things to move forward in a more, productive and positive way. Because, as has been said, looking at how some people have been treated and instances of unequal health outcomes and access. Um, it's terrible. It's embarrassing. But I want to do my part to try and be an ally and to work with my patients and their families to try and change some of that. And I would say that there are many people like that nowadays.
I just wanted to add one thing that really validated the decision for to donate Shawnee's organs was about a year after um, I got a letter from um, one of the recipients, and it wasn't mailed directly to me. It was sent to the organ donor people in Calgary, and they took out all the personal information of that individual, and they sent the letter to me, and it was a letter stating that this person said, "I love you. You're part of me." Like literally, Shawnee was a part of this individual, and then the person said I only had like less than, I don't know, something like 5% chance of living that day. And then the family got the news. They got the news that there was a, I think it was a liver. Um, and he said that he was a father and he had something like 4 grandkids, and that because of that, he's been able to go fishing with his grandchildren. And that day, that was one of the days where I think was really important to to know that we did the right thing. That Shawnee's death, um, through her tragic death, she blessed I was told 5 recipients of her organs. I don't know about the others how they did, but that's all I was told. And if she saved 5 lives, I often say my girl got a free ticket to heaven, through her death. And then, one of the things I just recently, I was talking to one of my daughter-in-law, and she said that about 2 weeks before Shawnee passed, they were jokingly saying that they were going to sign their organ donor cards. I think it was on the back of their driver's license or something. And then she said, and Shawnee said, I'm going to sign mine. And 2 weeks later, she died. So that was kind of made me feel better, because I was like, okay, good. She had thought about it, maybe just hadn't got around to actually doing the actual paperwork. But it just made me feel relief, because I was a big part of it too, is I was scared, like, geez, I hope she's not mad at me for doing this, because like I made the decision on her behalf. So that's why I did that myself. I filled out the organ donor application online. I've done it myself, so that when the time comes, my children or my grandchildren, they don't have to wonder. That decision has already been made, and they'll respect that.
Thank you both so much for sharing that, and for your thoughts as well, Ramona, on how to improve, some of the ways that we can be supported through, these difficult decisions as well. I know, yeah, it just strikes a chord and make me choke back some tears right now. But that's a part of life, is sharing our stories and sharing our experiences and sharing our loved ones with each other, and carrying on their memory and their messages as well. Something that I remember often from some of my mentors and teachers from back home too, is that even when we lose our loved ones, we carry their teachings and their love with us as well. And so when we share our stories, or we share moments or things that they've taught us with others, then they're living through us still. And your daughter's also living through other people with the donation of those organs to the people that received them. So just wanted to say miigwech to both of you for being a part of this conversation and this session today. I really appreciate the words that you shared. I know we have a couple minutes. One thing that one of my other mentors often did when he would wrap things up is he would ask, um, speakers or sometimes the participants to share maybe one word that resonates with how you're feeling after sharing today. So maybe I'll ask Ramona and Dr. Spence what's one word that might summarize how you feeling.
Peace.
Hopeful.
Me, which I appreciate that words you shared. So peace and hopeful, love it. So with that, I'll say thank you to the both of you, and maybe I'll move to introduce our next session as well. So thank you again, Ramona and Dr. Spence.